This is Plant-Based Briefing, Diet, Lifestyle, and Prostate Cancer, Part 2 by Dr. Shireen Kassam at plantbasedhealthprofessionals.com. I'm Marian Erickson. This is the Plant-Based Podcast where I curate a variety of articles on plant-based and vegan living and narrate them with permission in about 10 minutes or less every weekday. But this article is longer than that, so it's been broken into two parts. I read part one yesterday, so go back and listen to that first and then jump back here for the second half. And now let's get to today's Plant-Based Briefing. Diet, Lifestyle, and Prostate Cancer, Part 2 by Dr. Shireen Kassam at plantbasedhealthprofessionals.com. Specific foods implicated in the development of prostate cancer, continued. Soy foods and milk. One reason suggested for the lower incidence of prostate cancer in Southeast Asia is thought to be the high intake of soy products. Consumption of soy foods has been associated with a lower risk of prostate cancer in a number of studies. In fact, soy milk has been associated with a lower risk of prostate cancer, so if you're looking to swap out your dairy milk, then soy would be a good option for prostate health. If you already have a diagnosis of prostate cancer, adding soy to the diet could also help. One study examined the impact of soy intake on prostate cancer progression. Men awaiting prostate surgery were randomly assigned to either eating a diet high in soy or not. In the soy group, there was a significant decrease in the PSA level when compared to the control group. Soy consumption is associated with numerous health benefits linked here, including lower cholesterol levels and better heart, kidney, and bone health. Flax seeds. Flax seeds are an excellent addition to any diet with a number of health benefits. The active components include alpha-linoleic acid, or ALA, lignans, and fiber. Although firm conclusions cannot be drawn, there is certainly interest in their role in cancer prevention, including for prostate cancer. There may also be some benefit for those with established prostate cancer. For example, a study investigating the impact of flaxseed intake on prostate cancer progression randomly assigned men awaiting surgery to having either 3 tablespoons of flaxseed a day or not for an average of 30 days prior to surgery. At the time of the surgery, those that had been consuming the flax seeds had lower levels of prostate cancer cell proliferation when compared to the control group. Healthy drinks. Coffee consumption has been associated with a reduced risk of prostate cancer, but the effect size is small, with a 1% reduction in risk for each increment of 1 cup of coffee per day, whereas tea consumption, in general, does not appear to have a significant protective effect. The exception being that higher consumption of green tea, more than 7 cups a day, may have a beneficial impact. I think overall, if you enjoy drinking tea and coffee, then there's no reason to stop. However, if you do not, or caffeine results in side effects, then there are in general more impactful ways of reducing the risk of prostate cancer. Physical activity. Meeting physical activity and exercise recommendations is key for preventing a number of chronic conditions, including cancer. The guidance for adults is for 150 minutes of moderately vigorous or 75 minutes of vigorous activity per week, alongside resistance and strength exercises twice a week. Any physical activity is better than none when it comes to cancer, with as little as 3 to 5 minutes a day reducing the risk. Therefore, it seems rather counterintuitive that the evidence for physical activity for prostate cancer prevention is not very strong. In contrast, there is more robust evidence supporting physical activity interventions for those with an established diagnosis of prostate cancer, with improvements in metabolic health, fatigue, mental health, and quality of life, and a significant reduction in death from all causes. A randomized 12-week study of high-intensity exercise 3 times a week for 20 minutes was shown to improve cardiorespiratory fitness in men with prostate cancer and slowed progression based on PSA measurements. Other lifestyle factors. All pillars of lifestyle medicine remain important for cancer prevention and living well after a diagnosis of cancer. Avoiding alcohol consumption and tobacco smoking and maintaining a healthy weight will support better health in general and better outcomes from prostate cancer. Although sleep disorders increase the risk of cancer and are common in people with cancer, there are few studies specifically in prostate cancer. Maintaining healthy relationships and having adequate social support are also important for improving survival after a cancer diagnosis. Diet and lifestyle factors after a diagnosis of prostate cancer. Dr. Dean Ornish, American physician and pioneer of lifestyle medicine, provided us with key evidence for the role of healthy diet and lifestyle interventions for people with a diagnosis of prostate cancer, demonstrating that it is never too late to benefit. His study of 93 men with early stages of prostate cancer randomized half to a plant-based diet, regular exercise, stress management, and social support. The other group continued their usual diet and lifestyle practices. After 1 year, the intervention group had a significant reduction in the PSA level, whereas the control group had a rise in the PSA level. After 2 years, 27% of the control group had to go on and have conventional treatment like surgery or radiation, compared to only 5% in the intervention group. In separate studies, the mechanism by which these lifestyle interventions might be controlling prostate cancer growth was investigated. The same lifestyle interventions in men with prostate cancer were found to increase the activity of the enzyme telomerase in blood cells, which acts to maintain the length of telomeres and favorably alter gene expression in the prostate cells themselves. In fact, a more recent study demonstrated how a compound in cruciferous vegetables can activate genes that are implicated in suppressing the growth of prostate cancer cells. Increased consumption of healthy plant foods has more recently been shown to improve quality of life in men living with prostate cancer. After treatment for prostate cancer, men consuming the most fruit, vegetables, whole grains, beans, nuts, and seeds reported better sexual, urinary, and bowel function. Similarly, men consuming more plant foods and less animal-sourced foods may have improved cancer outcomes, including a reduced risk of cancer progression and improved remission duration and survival. Summary. Although more robust data would be beneficial when it comes to diet, lifestyle, and prostate cancer, there is sufficient evidence to use lifestyle medicine interventions to reduce prostate cancer risk and improve outcomes after a diagnosis. A plant-based diet has the strongest evidence for improving cancer-related outcomes, which includes avoiding red and processed meat, dairy, and alcohol. However, all pillars of lifestyle medicine remain important. Lifestyle medicine interventions can support better cardiometabolic health, mental health and well-being, and quality of lifestyle for men living with a prostate cancer diagnosis. You can find more information on a plant-based diet in our Plant-Based Eat Well guide linked here, adapted from the UK Dietary Guidelines. You just listened to Diet, Lifestyle, and Prostate Cancer, Part 2 by Dr. Shireen Kassam at plantbasedhealthprofessionals.com, and I'm your host, Marian Erickson. I've done a number of other episodes about cancer. Wherever you listen, or you can use the search field at plantbasedbriefing.com episodes, put in cancer and those will come up. And I will link some in the show notes that are related specifically to prostate and colon cancer, including 945, How to Become a Soy Equal Producer, 755, New Study, Plant-Based Foods Could Improve Men's Sexual Health After Prostate Cancer Treatment, 547, After a Prostate Cancer Diagnosis Spurred Me to Go Plant-Based, I Feel Like the Energizer Bunny, 502, Meat and Milk Linked to Colon Cancer, 494, Milk Drinkers See 60% Higher Rates of Prostate Cancer, 432, 3 Myths About Soy and Men Debunked, 148, Fight Erectile Dysfunction and 4 More Reasons to Go Plant-Based, 93 and 94, Cancer and Diet, Here's What You Should Know, and 33, How Not to Die from Cancer. So please share this episode with anyone who might benefit, and thanks for listening.